Hello, and welcome to our comprehensive guide on a topic that touches many lives: dementia and Alzheimer's in seniors. My name is Dr. Eid, and I'm here to provide you with valuable information, support, and understanding. As we age, our bodies and minds undergo various changes. While some cognitive shifts are a normal part of aging, conditions like dementia and Alzheimer's represent a significant departure from this norm. These conditions can be challenging, not just for the individual experiencing them, but also for their families and caregivers. In this video, our goal is to demystify these complex conditions. We'll explore what dementia and Alzheimer's truly are, differentiating them from normal, age-related forgetfulness. We'll delve into their causes, the various signs and symptoms to look out for, and the crucial importance of early diagnosis. More importantly, we'll discuss practical home and lifestyle solutions that can make a real difference alongside the available medical treatments and emerging therapies. We will also dedicate significant time to prevention strategies, empowering you with knowledge to promote brain health for yourself and your loved ones. Finally, we'll address the vital role of family support and caregiver well-being, acknowledging the immense dedication and emotional toll involved in caring for someone with dementia. This journey can feel overwhelming, but you are not alone. Our aim is to equip you with accurate, empathetic, and professional guidance. Let's embark on this important conversation together, fostering a community of understanding and support. Remember, knowledge is power, and with the right information, we can better navigate the challenges and enhance the quality of life for those affected. So, let's begin. Let's begin by establishing a clear understanding of what dementia and Alzheimer's disease truly are, as they are often used interchangeably but have distinct meanings. Dementia is not a specific disease. Rather, it is an umbrella term used to describe a set of symptoms that include memory loss, difficulties with thinking, problem-solving, and language severe enough to interfere with daily life. It's a general decline in mental ability that is severe enough to affect a person's daily activities. There are many different types of dementia, each with its own specific causes and characteristics. The most common types include Alzheimer's disease, vascular dementia, Lewy body dementia, and frontotemporal dementia. Each type affects the brain differently and may present with varied symptoms, though overlapping symptoms are common. Now, let's focus on Alzheimer's disease, which is the most common cause of dementia, accounting for 60 to 80% of all dementia cases. Alzheimer's is a progressive, neurodegenerative disease that causes brain cells to waste away and die. It's characterized by specific changes in the brain, the accumulation of amyloid plaques and neurofibrillary tangles. These abnormal protein deposits disrupt cell function and communication, leading to the symptoms we associate with the disease. The disease typically begins slowly, with early symptoms often attributed to old age or stress. Over time, symptoms worsen, impacting memory, thinking, and behavior. Understanding the causes and risk factors is crucial. Age is the greatest known risk factor for Alzheimer's, with the risk doubling every 5 years after age 65. However, it's important to remember that Alzheimer's is not a normal part of aging. Genetics also play a role. Having a first-degree relative with Alzheimer's slightly increases your risk. In rare cases, specific genetic mutations guarantee the development of the disease, though these are uncommon. Lifestyle factors are increasingly recognized as significant contributors. Conditions that affect heart health, such as high blood pressure, high cholesterol, diabetes, and obesity, are also linked to an increased risk of dementia. Other risk factors include a history of head trauma, social isolation, and low levels of education or cognitive engagement. It's a complex interplay of genetic, lifestyle, and environmental factors. Knowing the early signs and symptoms is paramount for timely intervention. While occasional forgetfulness is a normal part of aging, Alzheimer's symptoms are persistent and worsen over time. Here are 10 common warning signs, primarily focusing on Alzheimer's disease. First, memory loss that disrupts daily life. This isn't just forgetting names or appointments occasionally, but repeatedly asking the same questions or forgetting recently learned information. Second, challenges in planning or solving problems. This might involve difficulty following a familiar recipe or managing monthly bills. Third, difficulty completing familiar tasks at home, at work, or at leisure. For example, a person might struggle to drive to a familiar location or forget the rules of a favorite game. Fourth, confusion with time or place, losing track of dates, seasons, and the passage of time, or forgetting where they are or how they got there. Fifth, new problems with words in speaking or writing. This could involve struggling to follow or join a conversation, or repeating themselves, or calling familiar objects by the wrong name. Sixth, misplacing things and losing the ability to retrace steps. They might put things in unusual places and then be unable to find them. Seventh, decreased or poor judgment. This might manifest as making poor financial decisions, neglecting personal hygiene, or giving away large sums of money. Eighth, withdrawal from work or social activities. A person might start to avoid social engagements or hobbies they once enjoyed due to the changes they are experiencing. Ninth, changes in mood or personality. They might become confused, suspicious, depressed, fearful, or anxious, and easily upset in new or uncomfortable situations. And finally, changes in mood or personality. This could be irritability, anxiety, or apathy. It's important to note that experiencing one or two of these symptoms does not necessarily mean a person has Alzheimer's. But if you notice several of these signs, especially if they are worsening, it's crucial to seek medical evaluation. The progression of Alzheimer's is typically categorized into 3 main stages: mild, moderate, and severe. In the mild stage, the person may function independently but experiences memory lapses, especially forgetting familiar words or the location of everyday objects. Friends and family may notice difficulties. The moderate stage is typically the longest, and during this time, symptoms become more pronounced. The person may struggle to recall personal history, experience moodiness, withdrawal, and may need help with daily tasks like dressing. Confusion about time and place deepens, and behavioral changes like wandering or repetitive statements are common. In the severe stage, individuals lose the ability to respond to their environment, carry on a conversation, and eventually to control movement. They require extensive care around the clock. Communication becomes extremely difficult, and physical abilities decline significantly. Understanding these stages can help families prepare and adjust to the evolving needs of their loved ones. It's a challenging journey, but recognizing these patterns can guide the support and care provided at each step. This foundational knowledge is key to moving forward with strategies for diagnosis, treatment, and support. Always remember, early recognition allows for earlier intervention, which can significantly impact the quality of life for the individual and their family. Once you or a loved one notice persistent, concerning symptoms, the next crucial step is seeking a professional diagnosis. Early and accurate diagnosis of dementia, particularly Alzheimer's, offers several significant advantages. It allows for prompt access to available treatments that can help manage symptoms, plan for the future, and potentially slow the progression of cognitive decline. It also provides an opportunity to rule out other conditions that might mimic dementia symptoms but are treatable, such as vitamin deficiencies, thyroid problems, infections, or side effects of medications. So who performs the diagnosis? Typically, The diagnostic process begins with a visit to a primary care physician. If concerns persist, the individual may be referred to specialists, such as neurologists, geriatricians, psychiatrists, or neuropsychologists, who have expertise in cognitive disorders. The diagnostic process is comprehensive, involving several components. It starts with a thorough medical history. The doctor will ask about the onset and progression of symptoms, any existing medical conditions, medications, family history of dementia, and lifestyle habits. It's often helpful to have a family member or close friend present to provide additional observations, as the individual themselves may not fully recall or be aware of all their symptoms. Next, a physical examination is conducted to assess overall health and rule out other medical issues. This may include checking vital signs, reflexes, muscle strength, and sensory function. A neurological exam might also be performed to test balance, coordination, and reflexes. Cognitive tests are a cornerstone of dementia diagnosis. These are not memory tests in the traditional sense, but rather assessments of various cognitive abilities. Common screening tools include the Mini Mental State Examination, or MMSE, and the Montreal Cognitive Assessment, or MOCA. These tests evaluate memory, attention, language, visual spatial skills, and problem solving. More extensive neuropsychological testing may be recommended for a more detailed assessment of specific cognitive domains. Brain imaging techniques play a vital role. Magnetic resonance imaging, MRI, or computed tomography, CT scans, can help identify structural changes in the brain, such as brain shrinkage, or rule out other causes of cognitive decline like strokes, tumors, or hydrocephalus. Positron emission tomography, PET scans, particularly amyloid PET scans, can detect the presence of amyloid plaques in the brain, which is a hallmark of Alzheimer's disease. These scans can be particularly useful in confirming an Alzheimer's diagnosis and differentiating it from other forms of dementia. Laboratory tests are also crucial to exclude other treatable conditions. Blood tests might check for thyroid dysfunction, vitamin B12 deficiency, kidney or liver problems, and infections. Spinal fluid analysis can measure levels of amyloid and tau proteins, providing further evidence for Alzheimer's. The entire process aims to gather enough information to determine if dementia is present, what type it is, and what stage it might be in. This detailed evaluation allows for an individualized care plan. It's also important to understand the difference between normal aging and dementia. Occasional forgetfulness, like misplacing keys or forgetting a name, is common and usually not a sign of dementia. With normal aging, people can still perform daily activities and remember important events. Dementia, on the other hand, involves a persistent, progressive decline that significantly impairs daily function. For example, consistently forgetting how to use a familiar appliance, getting lost in familiar places, or having difficulty holding a conversation are more indicative of dementia. Remember, getting a diagnosis can be an emotional journey. It's okay to feel a range of emotions, from relief to fear. The key is to view it as a step towards gaining control and ensuring the best possible care for the individual involved. Don't hesitate to seek second opinions or ask your doctor for detailed explanations. The more informed you are, the better equipped you'll be to navigate the path ahead. Navigating life with dementia requires a thoughtful approach to daily living. While there's no cure for Alzheimer's, many home and lifestyle adjustments can significantly improve the quality of life for individuals and their caregivers. Let's explore these practical solutions, starting with creating a safe and supportive environment. As cognitive abilities decline, the home environment needs to adapt to minimize risks and reduce confusion. This means decluttering spaces to create clear pathways, removing tripping hazards like loose rugs, and ensuring good lighting, especially in stairwells and bathrooms. Install safety measures, such as locks on cabinets containing hazardous materials, and consider alarms on doors or windows if wandering is a concern. Using labels with words and pictures for drawers, cabinets, and rooms can help with orientation. Creating a structured and predictable daily routine is incredibly beneficial. Individuals with dementia often thrive on routine, which can reduce anxiety and confusion. Establish consistent times for waking up, meals, activities, and bedtime. Try to incorporate simple, enjoyable activities that engage the mind without causing frustration. This could include listening to familiar music, looking at old photo albums, gardening, or simple craft projects. Cognitive stimulation, even at a mild level, is important. Puzzles, memory games, reading aloud, or engaging in conversations can help maintain cognitive function for as long as possible. Social interaction is equally vital. Encourage visits from friends and family, participate in community programs tailored for seniors, or simply engage in daily conversations. Isolation can worsen symptoms, so fostering connections is key. Nutrition and hydration are fundamental for overall health and can directly impact cognitive function. Offer a balanced diet rich in fruits, vegetables, whole grains, and lean proteins. For individuals with dementia, meal times can become challenging. Serve meals in a calm, quiet environment. Offer smaller, more frequent meals if appetite is low. Use adaptive eating utensils if fine motor skills are an issue. Remember to ensure adequate hydration. Offer water, juices, or broths throughout the day, as thirst cues may diminish. Dehydration can exacerbate confusion and other symptoms. Physical activity, tailored to the individual's capabilities, is another powerful tool. Gentle exercises like walking, stretching, or chair exercises can improve mood, sleep, and overall physical health. Even short, supervised walks outdoors can provide fresh air and sensory stimulation. Always consult with a doctor before starting any new exercise regimen. Effective communication is perhaps one of the most challenging, yet rewarding, aspects of caregiving. People with dementia may struggle to find words, understand complex sentences, or remember recent conversations. Patience and empathy are paramount. Use simple, clear language, speak slowly, and maintain eye contact. Ask one question at a time and allow plenty of time for a response. If they struggle, try to rephrase the question or offer choices. Nonverbal cues, such as gentle touch or a reassuring smile, can often convey more than words. Validate their feelings, even if their statements seem illogical. For example, if they express a desire to go home when they are already home, acknowledge their feeling of wanting comfort rather than correcting them. Managing behavioral changes is another critical area. Dementia can lead to a range of challenging behaviors, including agitation, aggression, wandering, or repetitive actions. Try to identify triggers for these behaviors. Is it a change in routine, an unfamiliar environment, pain, or overstimulation? Distraction and redirection can be powerful tools. If a person is agitated, try to gently shift their focus to a calming activity or a favorite object. Maintain a calm demeanor yourself, as your stress can easily transfer to them. Sometimes, just a change of scenery or a quiet moment can help. Remember, these behaviors are often expressions of unmet needs or confusion, not intentional malice. Seeking support from professional caregivers or support groups can provide strategies and emotional resilience. Finally, personal care and hygiene can become difficult. Establish a consistent routine for bathing, dressing, and grooming. Break down tasks into small, manageable steps. Allow the individual to do as much as they can for themselves to maintain their sense of independence and dignity. If resistance occurs, try again later or find a different approach. For example, A warm bath might be more appealing than a shower. These home and lifestyle solutions, while not cures, provide a framework for maintaining comfort, dignity, and a sense of purpose for individuals living with dementia, and can significantly ease the caregiving journey. Every small adjustment can lead to a big difference in daily life. While lifestyle interventions are incredibly important, medical science offers specific treatments to manage the symptoms of Alzheimer's and other dementias. It's crucial to understand that currently there is no cure for Alzheimer's disease, but medications can help manage symptoms and may temporarily slow the progression of cognitive decline in some individuals. The goal of medical treatment is to maintain cognitive function for as long as possible, manage behavioral and psychological symptoms, and improve the overall quality of life. For Alzheimer's disease, the primary medications fall into two main classes: cholinesterase inhibitors and NMDA receptor antagonists. Cholinesterase inhibitors, such as donepezil, Aricept, rivastigmine, Exelon, and galantamine, Razidine, are typically prescribed for mild to moderate Alzheimer's. These drugs work by preventing the breakdown of acetylcholine, a neurotransmitter in the brain that is vital for memory and learning. By increasing the levels of acetylcholine, these medications can help improve memory, thinking, language, and other cognitive processes. Common side effects can include nausea, vomiting, diarrhea, and loss of appetite. They are not effective for everyone, but for many, they can provide a noticeable improvement or stabilization of symptoms for a period. The second class is the NMDA receptor antagonist, memantine, Namenda, which is approved for moderate to severe Alzheimer's. Memantine works by regulating the activity of glutamate, another neurotransmitter involved in learning and memory. In Alzheimer's disease, an excess of glutamate can lead to brain cell damage. Memantine helps to protect brain cells from this overstimulation. Side effects are generally mild and can include dizziness, headache, and confusion. Sometimes, doctors may prescribe a combination of a cholinesterase inhibitor and memantine, especially as the disease progresses to moderate stages. It's important to note that these medications do not stop the underlying disease process, but rather help manage its symptoms. Beyond these core Alzheimer's medications, doctors also address associated symptoms that can significantly impact daily life and caregiver well-being. These can include depression, anxiety, agitation, aggression, and sleep disturbances. Antidepressants, such as selective serotonin reuptake inhibitors, SSRIs, may be prescribed to manage depression and anxiety, which are common in individuals with dementia. Anxiolytics, or anti-anxiety medications, might be used for short periods to manage severe anxiety, but their use needs careful consideration due to potential side effects like increased confusion or falls. Antipsychotic medications are sometimes used to manage severe agitation, aggression, or hallucinations, but their use in elderly individuals with dementia carries significant risks, including an increased risk of stroke and death. Therefore, they are typically used as a last resort and with extreme caution, often after non-pharmacological approaches have been exhausted. Sleep disturbances are also common and can exacerbate other symptoms. Non-pharmacological interventions, like establishing a consistent sleep routine and optimizing the sleep environment, are usually tried first. If these are insufficient, sleep aids may be considered, again with careful monitoring for side effects. The field of dementia research is vibrant and constantly evolving, with new treatments emerging. There is significant ongoing research into disease-modifying therapies that aim to address the underlying causes of Alzheimer's, rather than just managing symptoms. For example, monoclonal antibodies targeting amyloid plaques or tau tangles are being investigated. Aducanumab, Aduhelm, and lecanemab, Leqembi, are recent FDA-approved medications that aim to reduce amyloid plaques in the brain and are indicated for early Alzheimer's disease. These are administered intravenously and come with their own set of considerations, including potential side effects like amyloid-related imaging abnormalities, ARIA. This represents a new frontier in treatment, moving beyond just symptom management. Regular medical follow-ups are essential to monitor the effectiveness of treatments, adjust dosages, manage side effects, and address any new symptoms. A collaborative approach between the individual, family, and healthcare team is vital for optimizing care. Remember, the choice of medication and treatment plan is highly individualized and should always be made in consultation with a qualified healthcare provider. They can help weigh the potential benefits against the risks and tailor a plan that best suits the individual's needs and stage of the disease. While the current medical solutions offer hope and help manage the challenging aspects of dementia, the ongoing research promises even greater breakthroughs for the future. While there's no guaranteed way to prevent dementia, a growing body of research suggests that a healthy lifestyle can significantly reduce the risk and potentially delay its onset. Many of the factors that contribute to heart health also contribute to brain health. Let's delve into proactive prevention strategies that empower us to take control of our cognitive well-being. Firstly, maintaining brain health through cognitive stimulation is crucial. Just like physical muscles, our brains need regular exercise. Engage in lifelong learning activities such as reading, learning a new language or musical instrument, solving puzzles, or playing strategic games. Staying mentally active creates new neural pathways and strengthens existing ones, building a cognitive reserve that can help the brain compensate for age-related changes. Secondly, prioritize heart health. The health of your brain is intricately linked to the health of your heart and blood vessels. Conditions like high blood pressure, high cholesterol, diabetes, and obesity in midlife significantly increase the risk of dementia later in life. Regularly monitor and manage these conditions through diet, exercise, and if necessary, medication in consultation with your doctor. A healthy cardiovascular system ensures optimal blood flow to the brain, providing it with the oxygen and nutrients it needs to function properly. Thirdly, adopt a healthy diet. The Mediterranean diet, rich in fruits, vegetables, whole grains, legumes, fish, and healthy fats like olive oil, has shown promising results in promoting brain health. This diet emphasizes antioxidants and anti-inflammatory foods, which protect brain cells from damage. Limit processed foods, red meat, and excessive sugar intake. Staying well hydrated is also essential for cognitive function. Fourthly, regular physical activity is a powerful preventive measure. Aim for at least 150 minutes of moderate-intensity aerobic exercise, such as brisk walking, swimming, or cycling per week. Incorporate strength training exercises 2 or more days a week. Physical activity improves blood flow to the brain, reduces inflammation, and can even promote the growth of new brain cells. It also helps manage other risk factors like obesity and high blood pressure. Fifthly, stay socially engaged. Social interaction and maintaining strong relationships are vital for cognitive health. Socializing can reduce stress, depression, and improve overall well-being. Participate in community activities, volunteer, join clubs, or simply spend quality time with friends and family. Avoiding social isolation is a key protective factor. Sixthly, ensure quality sleep. Restorative sleep is crucial for memory consolidation and for clearing metabolic waste products from the brain. Chronic sleep deprivation or poor sleep quality has been linked to an increased risk of dementia. Aim for 7 to 9 hours of uninterrupted sleep per night. If you experience sleep disorders like sleep apnea, seek medical treatment. Seventhly, manage stress and mental health. Chronic stress, depression, and anxiety can have detrimental effects on brain health. Practice mindfulness, meditation, yoga, or other relaxation techniques to manage stress. Seek professional help for depression or anxiety, as these conditions are treatable and their management can protect your cognitive function. And finally, avoid harmful substances. Smoking significantly increases the risk of dementia. If you smoke, quitting is one of the best things you can do for your brain and overall health. Excessive alcohol consumption can also damage brain cells and increase dementia risk. Limit alcohol intake to moderate levels, if at all. By integrating these strategies into your daily life, you are not only promoting brain health, but also enhancing your overall well-being. It's never too early or too late to start making positive lifestyle changes. Each small step contributes to a stronger, healthier brain and a better quality of life as you age. Remember, prevention is about empowering yourself with choices that support a vibrant future. Caring for a loved one with dementia or Alzheimer's is a profound journey, filled with unique challenges and deeply rewarding moments. Family caregivers often bear the primary responsibility, and their well-being is just as crucial as the individual they are caring for. Let's discuss the vital aspects of family support and caregiver well-being. The caregiver's role is multifaceted, involving assistance with daily tasks, medication management, emotional support, and navigating complex medical and legal decisions. This dedication often comes at a significant personal cost. Caregivers frequently experience increased stress, anxiety, depression, and physical strain. They may feel guilt, isolation, and a sense of grief for the person their loved one once was. It's essential to acknowledge these feelings and understand that they are normal responses to an incredibly demanding situation. Emotional support for caregivers is not a luxury, but a necessity. Recognize the signs of caregiver burnout, such as persistent fatigue, irritability, withdrawal from social activities, and feelings of hopelessness. Ignoring these signs can lead to serious health issues for the caregiver. Practical support is equally important. Respite care offers temporary relief for caregivers, allowing them to rest, attend to personal needs, or simply recharge. This can range from a few hours a week to short stays in a specialized facility. Don't hesitate to explore these options. They are vital for sustaining long-term caregiving. Support groups, whether online or in person, provide a safe space for caregivers to share experiences, gain advice, and realize they are not alone. Connecting with others who understand the unique challenges can be incredibly validating and empowering. Professional help, such as counseling or therapy, can also provide tools for coping with stress, grief, and other emotional burdens. Remember, it's a sign of strength, not weakness, to ask for help. Legal and financial planning becomes increasingly important as dementia progresses. Discussing these matters early, while the individual can still participate in decision-making, is ideal. This includes establishing power of attorney for healthcare and finances, creating a will, and understanding long-term care options and associated costs. Consulting with legal and financial advisors specializing in elder care can provide invaluable guidance and alleviate future stress. Effective communication within the family is paramount. Dementia can strain family dynamics. Open and honest discussions about the loved one's condition, care needs, and shared responsibilities are crucial. Dividing tasks among family members can prevent one person from becoming overwhelmed. Regular family meetings can help address concerns, make decisions, and ensure everyone is on the same page. Acceptance and adaptation are ongoing processes. It's challenging to witness the changes in a loved one, but learning to adapt expectations and find joy in small moments can transform the caregiving experience. Focus on what the person can still do rather than what they have lost. Celebrate small victories and cherish the present moments. Remember, the person with dementia still needs love, respect, and dignity. Finally, prioritize your own well-being. You cannot pour from an empty cup. Make time for self-care activities, however small they may seem. This could be a hobby, spending time in nature, or simply quiet reflection. Maintaining your physical and mental health is not selfish. It's essential for you to continue providing the best possible care. Caring for someone with dementia is a testament to love and resilience. By seeking support, planning proactively, and prioritizing your own health, caregivers can navigate this journey with greater strength and provide compassionate care to their loved ones. As we conclude this comprehensive discussion on dementia and Alzheimer's in seniors, I want to emphasize the key takeaways and leave you with a message of hope and empowerment. We've journeyed through understanding what dementia and Alzheimer's are, distinguishing them from normal aging, and exploring their complex causes and varied symptoms. We've highlighted the critical importance of early diagnosis, which opens doors to timely interventions and planning for the future. Our discussion on home and lifestyle solutions provided practical, actionable strategies for creating supportive environments, fostering engagement, and improving daily life. We also delved into medical solutions, acknowledging the current treatments that help manage symptoms, and touched upon the exciting advancements in research that promise a brighter future. Crucially, we spent time on prevention strategies, underscoring the power of lifestyle choices in promoting brain health and potentially reducing risk. And finally, we recognized the invaluable role of family caregivers, offering insights into their challenges and emphasizing the absolute necessity of support and self-care for their well-being. This journey with dementia can be incredibly challenging, but it doesn't have to be walked alone. Remember, knowledge is your most powerful tool. The more you understand about these conditions, the better equipped you'll be to advocate for yourself or your loved one. Make informed decisions and navigate the path ahead with confidence. Early action, whether it's seeking a diagnosis, implementing lifestyle changes, or building a support network, can significantly impact the quality of life. Embrace compassionate care, not just for the individual with dementia, but for everyone involved in their circle of care. Fostering understanding, patience, and empathy can transform the experience for all. To anyone facing this journey, know that there are resources available, communities ready to support you, and professionals dedicated to helping. Don't hesitate to reach out for help, to learn more, and to connect with others who share similar experiences. Let's continue to advocate for greater awareness, research, and support for dementia and Alzheimer's. Thank you for joining me in this important conversation. May you find strength, peace, and unwavering support as you navigate these paths. Your dedication makes a profound difference,